Welcome to a PreventConnect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
The things that you think we've learned over the last 10, that have changed in the last 10 years?
We really work very hard on tools. The spectrum of prevention as a way to make it easy for people to think comprehensively and to say, wait a minute, how do we change norms and environments? Well, it's looking at the practices of organizations, it's looking at policies, it's looking at the kinds of partnerships that we create, it's looking at, of course, individual skill building and educational efforts, and how do we engage providers more meaningfully, and how are all those elements synergistic with one another. It's looking at partnerships and the kind of tools we've created, from 8 steps to effective coalition building to the notion of collaboration multiplier. How do we get different sectors involved? Because what we're talking about when we're talking about violence against women is not public health, it's not family violence, it's not government, it's not business, it's all of the above. And what we've learned is how to shape and tailor tools to make it easy for people to apply this work. And the other thing we've learned tremendously is it's really different in a rural community than it is in an urban community. And it's really different perhaps in one part of the country where there's a certain set of policies and a certain set of government standards than in another place. And how do we build on one another's work? And one of the things that always fascinates me about PreventConnect is, on the one hand, there's the PowerPoint and the discussion and the theme, and on the other hand, along the side, there's a whole separate conversation going on, sometimes very related to what's the main theme of the conference, and sometimes really tangential, that it jumped off from there. And it's almost like there's an ownership, there's an intent of the PreventConnect community to cover what's most relevant for them. And that's a tremendous learning opportunity for all of us.
I have to say, there's some people that say they go to PreventConnect web conferences not because of the topic, but just so they have the opportunity to have a chat with other prevention practitioners around the country and around the world to be able to join this. And I know we just had someone from Scotland in our last web conference. The people in New Zealand are often waking up very early in the morning to be able to join us, to be part of that conversation.
Very humbling to think they're waking up early in the morning and they only want to be part of the conversation and don't want to hear what we have to say.
So let's think about, we're on our 10th anniversary, and I'm sort of amazed that it's been 10 years, but I also know that this work is long-term work. And so I want to think about where we're going to go the next 10 years. So I want to just get some of your thoughts of, where do you see that we can be moving, we as a PreventConnect community, we as a community of people that are committed to ending domestic violence and sexual assault, can move forward. So Lisa, what are some of your thoughts about where we can go in the next 10 years?
Well, I think the 10-year time frame is the right time frame to be thinking about. It's kind of actually hard to imagine what life will be like in 2025 and what technology will be available. But I think setting our eyes on, what is going to take 10 years to achieve, as opposed to what can I get done this year or in the next 2 years or 4 years. So, because I think change does take a really long time if we're really going about trying to create fundamental transformation. I think the most exciting work is really happening at the intersections between issues like domestic violence and sexual violence and other issues of racial justice, economic justice, environmental justice. I think there's such a great need to align with broader movements, and some examples are folks who are addressing the rights of domestic workers and addressing sexual assaults within that context, or working with farm worker women or restaurant workers who are really at this intersection of a variety of issues, including economic justice, gender justice, violence, and so on. And I think that's where the greatest collective power can come, and having an impact on multiple issues at the same time.
Great, thank you.
I think that, in health fields, often injury and violence is almost like outside. And, we're doing a lot of work right now on what we're calling transforming the health system. And when we think about transforming the health system, people talk to us about disease or they talk to us about chronic disease, and I always feel like I need to squeeze in injury prevention. And even when I talk about injury prevention, it's almost like another reach to get to family violence issues or to violence against women, domestic violence issues. And I think we're starting to see that soften up a little bit. And I think there's learnings for us around relevance. A lot of people over the last decade who've really zeroed in on chronic disease prevention, and particularly talking about eating and activity related issues like diabetes and stroke and heart disease. And one of the messages has been, if you want to think about those issues, you cannot ignore violence prevention. And also, even within the field of violence prevention, I should say the fields or the subfields of violence prevention. There's work on violence against women, which is different from work on suicide, which is different from work on street violence. Yet we know it's one set of families. It's all interrelated. There are ways that these pieces all need to fit together. And I think we're going to be figuring out a lot of that over the next 10 years. And this has been recently emerging as adverse childhood experience related issues and trauma informed care. And for me, the next 10 years, just as we've tried to move from care to prevention, are moving from trauma informed care at an individual level to community informed prevention of trauma. And I think that's a place we're going to start to see a lot of impact. That really what we're talking about is how to create health in communities, how to understand that if something is intergenerational, then we need to be sophisticated and multifaceted in the way we approach it. And speaking of intergenerational, I think our generation, it's time to really make sure that everything we know, we're not asking people to learn again. We're asking people to come with new eyes, with new vision, with new energy. But everything we know needs to be made available so that people can build on the experiences as opposed to restart and figure things out again. When some things we figured out really, really solid, it's time to use that as a platform for advancing the work in this field.
And for me, I think so much of the next 10 years is about the next generation of leadership. This work is not just about science, it's about a movement. It's about people coming together and being able to organize in ways to make a difference. And, I know Lisa and I, with our children at different ages, I now have a college student child who's now organizing around issues of economic justice and gender justice, and that we need to be able to think about how we're going to be able to help support the next generation of leadership. And that's where I really look forward to in 2025. I have no idea what instruments people will be using of technology, but I do know that the fundamental way that change takes place is by people connecting with each other in a common vision to be able to work towards where we can create change. And I believe PreventConnect has been helped contribute towards that, and I really appreciate the work as partners with Prevention Institute and for us being able to move forward. And thank you, and look forward to our next 10 years of work together. And thank all the people in the PreventConnect audience, because they're the ones that are actually doing the work on the ground in their communities. So thank you all, and we have another exciting 10 years where we learn even more and make even more changes.
And congratulations on your leadership, David. You've really made all this happen, and it's most appreciated.
Thank you all.
Thank you for listening to this PreventConnect podcast. PreventConnect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on PreventConnect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about PreventConnect, visit www.preventconnect.org. For more information about CalCASA's mission or to show your support, visit calcasa.org. That's CalCasa.org.